Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. We are discussing benign prostatic hypertrophy. Today, we are having second session of our discussion. So, dear viewers, let's discuss the comprehensive overview of important aspects of benign prostatic hypertrophy in learning sequence. Benign prostatic hypertrophy is a non-cancerous enlargement of the prostate gland, affecting men over 50 years of age. What are the causes and risk factors for benign prostatic hypertrophy? These are aging, age more than 50, it's more prone to develop BPH, then hormonal changes, the testosterone, dihydrotestosterone changes, genetics. It runs in the families, family history, obesity, sedentary lifestyle. These people are prone to develop benign prostatic hypertrophy, and medical conditions like diabetes and hypertension and heart diseases, they put a patient on the risk of benign prostatic hypertrophy. What are the symptoms of a patient having benign prostatic hypertrophy? These include urinary frequency. The patient needs to go to washroom again and again, urgency. He cannot control his urine. Weak or interrupted flow. The flow stream is very weak. And straining to urinate, the patient needs to strain. Nocturia, that in nighttime urination, is one of the common feature or pertinent feature symptom of the benign prostatic hypertrophy. Sometimes blood in the urine or semen, and of course, painful ejaculation. All these are the symptoms of benign prostatic hypertrophy. I repeat, urinary frequency, urgency, weak or interrupted flow, straining to urinate, nocturia, blood in urine or semen, and painful ejaculation. What are the stages? We doctors, we divide the benign prostatic hypertrophy into 3 stages. The mild stage, when there are minimal symptoms, moderate stage, when there is a noticeable symptoms, and severe stage, when significant symptoms and which impacts the daily life. How it is diagnosed? Of course, a history, then the direct digital rectal examination. By the finger, the doctor puts the finger into the anus and then feels if the prostate is enlarged. And of course, the ultrasound, pelvis, cystoscopy, urine flow rate, and prostate-specific antigens test. So the history, the physical examination, the ultrasound, and some lab tests, these are done to diagnose the prostatic hypertrophy if a patient has got BPH or not. What are the treatment options? One is the lifestyle changes, regular exercise, healthy diet, weight management, and stress reduction. All these leads to good symptomatic control of a benign prostatic hypertrophy. Then in the drugs, couple of drugs we tried to them. The alpha blockers like temsolocine, we use them. The alpha reductase inhibitors, that is the finasteride, then the phosphodiesterase inhibitors, sildenafil, and a combination therapy. These 2 different sorts of the medical therapy we give these patients to regress the size of the prostate. Then there are surgical options, and these include transurethral resection of the prostate. A small cutting tube is passed through the urethra into the bladder, and there it is resected. It can be a laser surgery, the open prostatectomy, and of course, the minimally invasive procedures. If a patient does not take care, what can be the complications? The complications include urinary retention. The patient go into urine retention. Bladder stones can develop. The kidney damage can be there. That is called the obstructive uropathy. Erectile dysfunctions may happen, and at times the libido decreases there. The libido is decreased in such patients. So benign prostatic hypertrophy is a condition, but it is essential to rule out prostate cancer. This is very, very important. If you experience any symptoms or concerns, consult a healthcare provider. He will take your history, he will do the examination, he will do the investigation, and to show that whether you have got the benign prostatic hypertrophy or not, whether your prostate is enlarged or not. If the prostate is enlarged, whether this is a benign or this is, God forbid, a malignant thing. So, my dear viewers, to conclude, benign prostatic hypertrophy is a common condition among men over 50, but it's manageable. Recognizing symptoms like frequent urination, weak flow, or incomplete emptying of the bladder is the first step toward improving your quality of life. If you have been experiencing these symptoms, don't ignore them. Consult a healthcare provider to discuss treatment options and regain control over your daily life. Benign prostatic hypertrophy is often seen as a part of aging, but it does not have to control your life. Share this information with friends and family. It could help someone in need. Remember, taking care of your prostate health is not just about solving a problem. It's about living a healthier, happier life. And that's something every man deserves. If you found this video helpful, don't forget to like, share, and subscribe for more health tips insights. And let me know in the comment sections below if you have any questions or topics you would like to cover next. Till the next vlog, take care. Khuda Hafiz.